The broadcast is now starting. All attendees are in listen-only mode.
Thank you for joining the Front Desk Management webinar. My name is Sonia Daniels and I am the Practice and Workforce Support Officer in Rural Health West. I've had extensive experience in medical practices, originally working as a receptionist and then going on to practice management, obtaining a diploma in practice management and gaining considerable knowledge in this field in the process. Just a couple of housekeeping issues. We will keep the presentation on mute, but please feel free to write in any questions that you might have. I will try to answer your questions at the end of the presentation. Now, first impressions are lasting impressions. Receptionists are often the first people that patients interact with when they phone or visit a practice. Therefore, they're having an essential position within the practice. This interaction reflects upon the whole practice, and those first impressions really count. The receptionist's manner and efficiency can either enhance or damage the experience that the patient has with the practice. The demands of the position change from minute to minute and are often unpredictable. Receptionists have a significant portion of their work involving managing the care of patients and families, which can be from congratulating a new mother, to consoling a man whose wife has just died, to helping a mentally ill patient make an appointment. A positive attitude and a courteous, friendly manner can influence the way in which patients feel as they sit in the waiting room and will largely depend upon how the receptionist has reacted to and greeted them. So show hospitality and make the patient feel welcome. A kind or friendly face goes a long way to setting the scene for the remainder of the patient's visit. It is the receptionist's role to dispel patients' fears and worries and to help them feel comfortable while they wait. Patients will react in a positive way when they get an attentive, timely, dependable, efficient, courteous and friendly service. The patient wants to feel they are being treated with respect, so listen and show an interest. They need to know that their questions are going to be answered with the correct information. So take the time to answer thoroughly and offer expansive responses. Yes and no answers without follow-up statements can be viewed as being very abrupt and imply that you do not have the patience with the patient. A positive attitude will give the patient confidence that they are being dealt with efficiently and will aid in averting conflicts. Unfortunately, even with the best will in the world, conflict will arise. But more of that further into this webinar. Never mentioned on a job description form, one of the most important skills for a receptionist is the ability to read patients. Look for subtle clues about their current mood, patient level, personality, body language, and you will go far in keeping your patient interactions positive. Likewise, using the correct words makes a substantial difference in the communication process. Using complicated language often builds barriers to effective communication. The best means to get your message across when speaking to patients is to keep it simple. A quote by Will Rogers says it all: strange words are not friendly words. So use influencing language that is aimed at creating a positive situation. Ability to use positive language is important for influencing the situation. For example, instead of Dr. Smith is fully booked, which creates a negative vibe, use positive, productive words. For example, the next available day is Wednesday. Would you like the morning or afternoon? And add their name. This way you are not concentrating on what a patient can't have, but what they can have. When you give an either-or alternative by saying morning or afternoon, that channels the patient to where a more appropriate time slot is. Show empathy and enthusiasm, but know the difference between being pleasant and friendly and being too personal. Almost as bad as ignoring someone is assuming a relationship that does not exist. Unless a patient offers personal news, Do not ask questions that might backfire or lead to protracted stories that you do not have time for or are not really interested in. So how did your daughter's wedding turn out? It might seem like a safe enough question, unless the answer is, she got stood up at the altar, started drinking heavily, wrecked the car, and so forth. So there is a limit to how much you can spend with a patient. The trick is how that should be applied without offending the patient. Involve a colleague if needs be, or by excusing yourself to discuss a work matter. If you were sitting, stand up. It is easier to ease yourself away from the protracted conversation. Another item, look professional. An overabundance of anything, hair, makeup, jewellery, fragrance, fingernails, it's less than professional. The same holds true of workstations. Lose the clutter. Keep food out of sight and ensure there is no patient notes on the desk to be overseen by other patients. When you look the part, you will give the impression of being professional. Moving on to telephone techniques. Good telephone techniques leave the patient with a positive impression of you, the doctor, and the practice. Good telephone management shows that staff are caring, attentive, and helpful. Poor telephone management results in bad feelings, misunderstanding, and unfavourable impressions. Always answer your telephone in a clear, warm, friendly tone with a smile on your face. Be courteous, calm, and pleasant. You may have a patient that is hard of hearing or does not use English as a first language. Therefore, it is important to speak clearly. Pause between phrases or sentences and keep your voice at an appropriate volume. Vary your tone. Nobody wants to speak to a monotone robot. Likewise, nobody wants to speak to someone with a bad attitude. So even though you might be having a bad day, leave your worries at the entrance and bring out your inner acting skills and be polite and helpful. Also, keep it professional. Avoid slang and jargon, and do not use terms of endearment. Keep a pen and paper near the telephone to take notes, especially important when handling a multi-line telephone. Though keep in mind that you must maintain confidentiality with written telephone messages. For example, email messages, or if you're using a telephone pad with duplicate copy pages, it could breach the patient's privacy if a third party can access the note. So be mindful of what you write. Now, answering the telephone. Answer the call promptly, preferably within 3 rings. Follow practice policy on greetings, which should include the practice name and your name. A simple greeting is sufficient. For example, hello, this is Rural Medical Practice. This is Sonia. If the caller does not give their name, ask for it. You need to verify the patient by asking 3 identifiers, which can include name, address, date of birth, gender. Do not prompt the patient by asking if the address is correct or any of those questions. You really need to let the patient volunteer the information. This will further verify that you have the right patient and will also alert you to any change of details for your data. Identify the nature of the call and determine the urgency. You do need to follow the office policy to determine how to triage calls and what to do in an emergency. You need to identify the calls that should be put through immediately, should be handled by another staff member other than the doctor, or if it can be returned later. Do not give any medical advice unless you are authorized and trained to do so. You need to develop the ability to really listen to patients. Show empathy by trying to communicate an understanding of the caller's feelings. Do not rush your caller. Ensure that you have the correct information to enable you to pass the call on to the correct person. Be aware of the language and terms used. You really need to assess the situation before it escalates into something unpleasant. It is annoying and potentially dangerous from a patient perspective to be told to hold the line when telephoning the practice for medical assistance. The importance of the receptionist determining the reason for the call before putting the caller on hold cannot be emphasized enough. In a general practice environment, emergencies are bound to occur, and whatever the situation, putting callers on hold without initially asking first is unsafe. Of course, it is sometimes necessary to place a patient on hold. Ask them if they may be placed on hold and wait for a response, and ensure, of course, that it's not an urgent call. Thank them before placing on hold. Now be aware of the wait time and do not leave them on hold for long periods of time. If you cannot get back to them in a reasonable time to finish the conversation, thank them for holding and ask them if they can hold a little while longer, or give them the option for you to call back and take their number, and of course apologize for the delay. Use the patient's name. Callers feel important when their names are used. Does your organization have music or a recording while they're on hold? It's a good way of the patient knowing that they are still connected and have not been cut off. Remember, long holding periods can be very costly for mobile phone users and lead to upset, which we are aiming to avoid. Often calls can be lost when being transferred. Try to avoid this happening by knowing all the features on your telephone. Staff should develop a short list of those callers who are necessary to interrupt the doctor or a staff member. If you can be overheard by patients and it is not of a general nature, show them a written message rather than communicating it verbally. Mouth noises. People do not appreciate heavy breathing down the telephone, sniffing, coughing, or appreciate being spoken to by someone who is eating something at the same time. You should not drink whilst talking on the telephone either. If you have to sneeze, cough, or something similar, put your hand over the mouthpiece of the telephone and apologize to the caller when you return to the call. Now, there's nothing worse than speaking to someone and they have a lack of interest in the conversation and they're not paying attention. A lack of interest can often cause a breakdown in communication and the caller to be put through to the wrong extension, or worse still, a message not being taken correctly. Also irritating to the patient is being asked to hold on whilst you speak to someone else. If you do have to do this, apologize to the caller first before you speak to the other person. And then when you go back to the caller, thank them for holding. Always use the hold button and never just put a phone down on the desk, as the caller will hear all of your dealings. To control the direction of the telephone call and to avoid a prolonged call, it is important to use positive and persuasive language. For example, instead of having a long, protracted conversation about which days and hours and specific time slots that Dr. Smith works, a more constructive approach would be, the next available day that with Dr. Smith is Wednesday. Would you like morning or afternoon? Now, this speeds up the booking process, but it also takes into account the patient's wishes. Now, check for understanding. Ask questions to ensure the caller understands that you have discussed and that you understood them. Summarize the important points. When making an appointment, ensure that you repeat the time, day and date and the doctor that they have been booked with. Now, dealing with a prolonged call. Be patient. Great service beats fast service. Patients may be confused, frustrated or worried and will continue talking, and it may be necessary to bring the encounter to an end. Find a polite way to end the conversation, such as excusing yourself to answer when the other phone starts ringing, or state that you have to attend to a patient that is waiting at the counter. Apologize for ending the call, wait for a response, then hang up. Ideally, the other person will hang up first. Now, moving on to dealing with difficult callers. Listen without interrupting. Let the caller say what he or she needs to say. Be understanding and speak in an emphatic, empathetic way, but speak confidently and respectfully. Remain calm and do not take offence. You can apologise for the situation that has made the patient upset, but do not accept fault. If you cannot solve the situation immediately, call the person back and give them an update or more information as available. And of course, do not promise what you cannot deliver. More ways to handle a difficult patient further into this webinar. Now, when you're calling a patient, make sure the person who answers is the correct person by asking for 3 personal identifiers. If you are speaking to the patient, identify yourself and the practice. Be prepared with the details you need to discuss. If the patient requires an appointment, be ready with options. If you are not speaking to the patient, determine if it is suitable to leave a message, and be careful not to release any confidential information to a third party. You need to be mindful of leaving messages on answering machines, as a third party can intercept the message. If you determine the message can go on an answering machine, it should be kept to a minimum. To end the conversation, by thanking the caller by name for calling and allow the caller to hang up first. Now, answering machines. Some people do not like answering machines, especially the elderly, so avoid using them as much as you can. You will need to use an answering machine after surgery closes and perhaps lunch times. Always ensure that your message has a clear, up-to-date message on it before you close for the evening. Repeat any telephone numbers slowly and repeat them twice. Do not use an answering machine at lunchtime if your surgery closes. If so, ensure that you check it as soon as the practice opens after lunch and deal with any messages left on the machine. Again, ensure that the message lets your patients know when you are open again after lunch. Remember to have the appropriate messages on each evening and lunchtime. Emergency contact details and advice to call 000 in an emergency should be included in all messages. Moving on to dealing with difficult patients. Now, difficult patients can often come in a wide variety. They fall into several categories: picky people, know-it-alls, constant complainers, patients that will not listen to reason, and hardest of all, the angry patient. Now, this is someone who feels that he or she has been wronged and is upset and emotional about it. These patients will often complain, and usually about something that you or the surgery did, or didn't do actually. Each patient and situation is different and will be dealt with in various ways by staff. But it is how we handle them that is the most important thing, and that can make all the difference to the end result. Finding techniques that help you disarm unhappy patients and win them over is the key to providing great customer service, even when all you really want to resort to is giving them a piece of your mind. Try to make their day better by being pleasant. It'll make you feel good too. Poor communication and misunderstandings can quickly lead to deterioration in your relationship with a patient. Being confident at handling difficult patients is an asset to the practice and a credit to you if done well. It will help with your confidence when dealing with the next difficult patient. Now, everyone has bad days, and sometimes you are going to come across people that you will never be able to make happy. Some situations are out of your control. Maybe they had a fight with their spouse, had no sleep for 2 nights with a crying baby, or have had a run of bad luck. We've all been there to some degree. Rudeness or bad behavior is no excuse, but we know that it's going to happen at some point when you are dealing with the general public. and more so when you are dealing with people who perhaps might have medical conditions that might heighten their concerns. Even patients who are normally calm may quickly reach boiling point when illness threatens their health, mobility, and independence. Pain and fear can lead to increased stress, anxiety, and frustration, which can result in anger and even loss of control. It is important for you to take a step back from the patient who is angry and ask yourself, what's really going on here? If the patient is actually frightened, then you'll have to approach the patient differently than if they were truly angry over something, such as a long wait time. Even anger over a long wait time can mask a fear of not knowing what is wrong with them. Once you are aware the patient is unhappy, prepare to deal with it and try to control the situation. Remain calm, although it is often hard when someone is being rude to you or perhaps shouting at you. If we know what to say, and more importantly, how to say it, we may be able to save the situation. For the receptionist, dealing with difficult patients can be upsetting, especially if they are made to feel that the complaint is directed at them personally. Try to remember that people act in various ways when they are upset, worried, or in pain. Try to put yourself in the person's shoes. If it were happening to you, how would you like the situation to be dealt with? Deal with the situation to the best of your ability. Apologize to the person that they are upset, and often when the problem has been solved, they will more often than not apologize for their outburst. And of course, sometimes the patients are right in their concerns or complaints. Not their outburst, but they might actually have a complaint that is justified. Now, you need to look for the signs. You need the ability to read patients and listen to patients. Watch the language and terms used. Look for subtle clues about their current mood, patient's level, personality, and you will go far in keeping your patient interactions positive. There are signs that indicate a patient's emotional state is deteriorating. Look for changes in body language, including a tightening jaw, tense posture, clenched fists, fidgeting, intense staring at you, and any other significant change from earlier behavior. A talkative person, for example, may suddenly become quiet. Observe the patient for additional signs that their temper is rising. Is their voice raised? Are they demanding excessive attention? Early detection of a patient's anger can be diffused quickly if you are alert to the signs. Ideally, you need to avoid the initial complaint escalating into a full-blown situation. If you detect any of these warning signs, you will need to act fast to diffuse the situation. You need to help the patient vent their feelings in a productive manner. Start by spending extra time with the patient. Although you might be tempted to spend less time with them, doing so only increases your risk of the incident escalating. Ignoring complaints, or say rushing the person to get the situation resolved, will only ignite the situation. Your listening skills are vital at the early stages. Allow the patient to vent their anger. Let the patients have their say, excuse me, even if you know what they are going to say next, and even if they may not have all the information, or they may be mistaken about the facts. Let them talk. As you listen, maintain eye contact and adopt an open body posture. Nodding is a useful way to agree with the patient by not interrupting them, but by giving them assurance that you are listening. Move back from the patient so there's plenty of space for the patient, and do not respond until they've had their say. Do not try to talk over the patient and do not argue with them. Embrace silence. Surprisingly, silence can be very effective non-verbal intervention. Silence in your part allows the individual time to clarify their thoughts, and it provides valuable time for you to reassess the situation. So now is the time to utilize your acting skills. Be immune to all insults. Keep your cool. Don't get manipulated by the patient's anger, and remain professional by never getting angry or upset. It will only turn an unpleasant incident into something much bigger. Show accepting body language by let your arms hang loosely at your sides rather than standing with your hands on your hips or your arms crossed. It's important to engage with people that protects their self-esteem. So do not try to set limits by saying, calm down or stop yelling. By talking down to someone, arguing back, trying to justify the position, or using logical argument to someone who is already upset will only upset them more and make the situation even worse. Do not grovel, and rather than becoming defensive, respond calmly to the patient and treat him with respect. This is easier said than done when someone's in front of you or on the telephone throwing a temper tantrum, but it's the only way to handle this situation. Try to identify the event or the underlying reason that triggered the outburst. Now, do not take it personally, ignore personal comments and rudeness, and do not get personal yourself. Remember, the patient does not know you, and they are just venting frustration at you because you are the only representative of the practice on show. Also, do not be deliberately casual or icily superior to show an offensive patient what you think of them. Treat people as you would like to be treated yourself, and you cannot go far wrong. Once the patient has had their say, acknowledge the source of their frustration and show empathy. Show that you understand their position and situation. Use a natural tone of voice and call the patient by name. Offer calming phrases like, I understand, that must be so frustrating, and let me see what I can do to help. These few short phrases can often solve a difficult situation at this point. The patient feels heard and understood. Paraphrase back to the patient what they have already told you, while at the same time identifying the real feelings behind the words, fear or helplessness, for instance. When you paraphrase, you are repeating what they said, and of course, they have to agree with you. It puts a positive edge to the encounter, and it shows you understand the problem. If the patient gets louder, start speaking more slowly and in a lower tone. Your calm demeanor will reflect on them and will help them to settle down. As you approach the situation with a calm, clear mind, unaffected by the patient's tone or volume, anger will generally dissipate. It is hard to maintain a good rage when you are faced with someone that remains polite, calm, and reasonable. Now, don't be sickly sweet either, because that can often come across as patronizing, but be genuinely nice. By doing this, it often will solve a bad situation very quickly. Keep it simple and leave nothing to doubt. So you can express regret about the situation. Try to find some point of agreement, perhaps acknowledging the complaint is a valid one, or asking the patient's solution to the problem by using phrases like, can you tell me what you need? Or perhaps, do you have some suggestions on the ways that we can help you with this? The most satisfying remedy for the position is an apology for the specific inconvenience only, with a short explanation. So rather than say, I'm sorry you've been kept waiting, say something more along the lines of, I apologize for your long wait. It's been a hectic morning. Some of the patients have needed extra time. Now this way you are taking more responsibility for the situation, and by keeping your statements short and simple, it's going to help the situation. More examples for you. I understand your problem, and I assure you I am trying everything to help you. Please take a seat and I will let you know as soon as I have any information. Now that's going to be a lot more calming and effective than saying something along the lines of, I'm doing all I can here, you'll have to take a seat and wait your turn. It's very inflammatory, and we want to put out those flames, not start them up. Assure the patient that you intend to take immediate action to reach an acceptable arrangement. Offer options by saying, here's how we could handle this. If you cannot solve the problem immediately, offer to explore the situation in more depth. Let the patient know exactly what to expect, and then be sure to follow through on your promises. Document the conversation to ensure that you're well prepared for the next interaction. Or if the incident is over the telephone, give the caller an estimated time that you will call back. Do not end the call with, someone will call you back. Be specific. And if you say you will call back in 10 minutes, make sure you do. Even if you promise an update that you do not have yet, call the patient at the scheduled time anyway. The patient will be reassured to know that you are not trying to avoid them, and they will appreciate your follow-up. Now, if the patient is swearing or being verbally abusive, take a deep breath and continue as if you did not hear them. Responding in kind will not solve anything, and it will usually escalate the situation in a negative direction. Instead, remind the patient that you are there to help them and gently guide the conversation back to the issue at hand and how you intend to resolve it. Wait times for doctors are probably one of the biggest irritations for patients. If the doctor is running late, inform the patients as soon as they come into the practice. I mean, after all, they might be running to a schedule too. So determine if there's anything that the practice nurse can help out with prior to the appointment, just so that you've done everything you can to help the situation. Another idea is to assume all the patients are watching. Remember, you're not only really talking to the difficult patient, but to an audience of patients in the reception room that is watching this interaction. Now, this shift in perspective can provide an emotional buffer if the patient is being verbally abusive, and will allow you to think more clearly when responding. If you cannot solve the problem, contact the patient and let them know that you have sorted it out. You often will find by this time they have completely calmed down anyway. I think we have to accept that we cannot win every situation. So know when to draw the line and know when to give in. Know in advance what you will tolerate and what you will not. Always acknowledge your gut feeling when you feel unsafe and act on it by alerting other staff. If it is clear that you are not getting anywhere with the aggressive patient, you need to politely but firmly let them know this is unacceptable. Be patient and emphatic, but be firm. If trying to satisfy the patient is going to take a couple of hours and several Panadol later, it's probably best to draw a compromise a bit more in their favour to alleviate the immediate problem. Keep in mind that the interaction is not typical of most patients and that you are dealing with an exception. Now, if things do escalate, you may need to acknowledge that you cannot deal with this particular situation. This might be an opportune time to call for assistance from a colleague. Do not be afraid to remove yourself from the situation if you feel that you are not in control. It's best to ignore the odd swear word, but if the patient is excessively swearing, politely ask them not to swear. It's amazing how many people do not realise that they've even sworn and they will apologise for it. If they continue to swear, you have every right to ask them again not to swear. If they still take no notice, you should have the right to tell them that if they do not conduct themselves in a more professional manner, you will not be able to help them any further. If the patient is on the telephone, you can tell them that if they continue to swear, you will hang up. Now, be aware of the position of the door or an emergency button should you require it. Keep some distance between you and the patient, preferably a barrier such as a desk. If the patient threatens you physically or you fear for your safety, do not hesitate to contact security or the police. For more immediate assistance, consider establishing and using a code phrase that indicates to other staff members that you require assistance. Now, it's recommended that any complaint that you receive, no matter how small, be recorded in some way, perhaps in an incident report form. Complaints often have a habit of coming back at you weeks down the line and can often leave you unable to give an accurate account of the incident. The form would be completed by the member of staff that was involved in the initial incident. Keep a file for the incident reports. Number each incident report. This way you can keep a record of each form. You need to decide if the incident is a complaint or just an incident. If it is a complaint, you need to contact the person concerned and deal with it appropriately. With an incident, you need to decide if you need to contact anyone or just to record it and discuss it with your manager about what could have been done differently, if at all, anything could have been done differently. The idea behind an incident report form is to bring awareness that something has happened and needed to be discussed, and a procedure could be developed and put in place to avoid the same incident occurring again. Now, this process would be classified as a quality improvement activity and is one of the criterions in the Royal Australian College of General Practitioners accreditation standards. But most of all, most important, is learn from each experience and use the interaction as a learning experience by determining how you can improve on your skills and avoid the escalated incident happen again. The point is that you do not have to make an angry person into a happy person. All you have to do is to get them to go away with whatever it is that they came in to get, within reason, of course. Thank you. Now, do we have any questions from anybody that I can help with? You can type them in the screen. There's no questions coming up at the moment, but please feel free to. Or, of course, you can always email me with anything that you'd like to know. Also, what I'll do, I'll send out the PowerPoint display to all the participants. And I've also devised an incident report which might be quite useful for the practice. I can send you a copy of that. And I've also made a list of useful phrases, like we spoke about in the webinar earlier, about how to get the conversation flowing in the right direction so that works in your favour. Handy little comments that I think will work quite well for the practice. I'm just checking something here. Nope, we've covered it all by the looks of it, according to Angela. Okay. Excellent. See you later. As I say, please feel free to contact myself, any questions, anything you'd like to know. But otherwise, thank you for joining us, and hopefully you will join our next webinar on the practice incentive payment. That's going to be held in 2 weeks' time. Thank you.